Okay, well, hi everybody. Thanks for joining us for our third and final session of our three-part series. Once again, thank you so much to Zoetis for sponsoring our program and providing our door prizes, because that's fun. And I will let Dr. Quaschnick take it away.
All right, thanks, Sandy. So we're going to see if the third time's a charm here today with our third and final installment of the Not So Traveling Roadshow. And today's topic is nutrition. And I really can't state strongly enough the impact that proper nutrition has on the health, performance, and longevity of our horses. You know, we feed our horses daily, multiple times daily even, and this has a chance to impact their health with every meal. So we're gonna dig into a few concepts here. I'm just gonna pop off camera so you don't see the weird and wonderful things I do with my hands while I'm talking, and we will get into the content of today's presentation. So as a brief overview, we're gonna go over the basics of equine nutrition, and then kind of turn that on its head a bit and look at things from the cellular perspective. And then we're going to spend some time talking about how to assess your horse's nutritional status, and then just drill down on some action steps, you know, to really put the content that we've learned today into action and just compare it to what you're already doing, and maybe identify some places where you can make some interventions that are meaningful. So when we consider horses, they do have some key characteristics that we need to keep in mind when designing their feeding programs. They are herbivores, and they are designed to process forage into usable fuel. You know, I don't think a keto diet is something that's going to work well for them, but they are non-ruminants, and that means they don't chew their cud like cows and goats do. They get one chance at chewing their food. They don't get to regurgitate it to, you know, chew down the particle size a little bit more. Their teeth have one chance at reducing particle size. And then horses, they're hindgut fermenters. And this means that they have a large microbiome in their cecum and their colon that breaks down fiber. And this is what makes horses able to digest fiber and live off of grass, whereas we cannot. And so horses are quite similar to a simple stomached animal right up until the end of their ileum. That's the end of their small intestine. And then this is where the magic really happens here in the hindgut. This hindgut fermentation also has implications for different toxins and medications. Things that we can give to a ruminant that first must pass through their rumen may not be safe or appropriate to give to horses. An example of that is rumensin, which is utilized by the microbes that are in the foregut of cattle. That's where their fermentation vat is located. Or things like urea. There's supplements that people put out for cattle that horses also have access to that have high levels of urea that cattle stomachs are able to fix into protein. Those would be inappropriate for horses because that urea would be absorbed into the bloodstream prior to it hitting the hindgut. So there's just some structural differences that we need to be mindful of and considering cattle versus horses when we're at the feed store. Horses also have relatively small stomachs for their body size. It's roughly about a 2 to 4 gallon capacity. And so this is important when it comes to feeding frequency. By design, horses do better with continual grazing. It's kind of like they have a gastric sleeve, you know, where they're required to have smaller, more frequent meals because they don't have that capacity in their stomach for big bulk digestion. Horses are also continuous acid secretors. So this is in reference to their gastric glands. So this means that their stomachs are always producing acid, which is in contrast to us, who produce acid in response to meals. Again, this reflects that horses do better with continual ingestion of feed. So what do horses require in terms of nutrients? Like every other mammal, horses require water, fats, carbohydrates, vitamins, minerals, and amino acids to meet their needs. Their exact requirements are going to vary, and that's going to vary based on age, on health status, if they're combating a disease, their activity and exercise levels, as well as their reproductive or lactation status. So we're going to pop up our first polling question. So if you guys want to get your trigger fingers ready, our first question here is true or false? Horses have nutritional wisdom, meaning that they can sense a nutrient deficiency within themselves and adjust what they consume in response. I should probably answer it here since it's up on my screen. You know, we often hear, oh, that horse is, you know, really getting after that mineral block. All right, kind of a split 2/3, 1/3 here of true or false. This, in fact, is false. They don't have this nutritional wisdom. They do have a drive for salt, energy, and fullness, but not a specific drive to identify a particular component or nutrient and seek out more of that. They're really just going after salt when they're looking at these different kinds of abnormal eating behavior. So don't let them eating weird things or not eating things let you think that, that they don't have a specific deficiency or different needs. I'm just having experiencing a little technical difficulty here. All right, that let me advance there. So since horses lack this nutritional wisdom, we must endeavor to supply as balanced of a diet as possible. In considering a 500-kilogram adult horse in varying levels of work, we can see here the different daily requirements. We're looking at around a 20,000 to 26,000 calorie requirement for energy, and consider that an adult human needs about 1,500 to 1,800 per day for maintenance requirements, just for context. But I guess I think the horse requirements probably more closely reflect my quarantine snacking behavior and caloric consumption when I've been stuck at home. But they do have, you know, at least a tenfold multiple of what we require per day in terms of calories. And then the macrominerals that are supplied, these are the ones that are chiefly supplied by the diet and independent of any supplements you'll be giving. You can see that these are the ones listed in grams. So the calcium, the phosphorus, magnesium, potassium, sodium, chloride, and sulfur. And just to give you a little context on these requirements, a teaspoon of salt is about 5 grams. So you can kind of have a visual idea of what that looks like in terms of volume or amount of salts and electrolytes that they need. To take a look at the protein numbers, you know, the horses, they need about, you know, 600 to 800 grams of crude protein a day. And just think about your protein powder that you may throw in a morning smoothie. And those are generally 3 to 4 grams of protein per tablespoon. So you can just, you know, visualize what that looks like going into your horse. We have our trace minerals here, and you can see that the units are different. These are called trace minerals because they only need such a small amount. It is a critical amount that is required for enzymatic function largely throughout the different systems of the horses. But we can see that this is often like 1,000 times smaller, being in the milligram units. And this is where we really lean on trace mineral supplementation, because pastures and forages vary widely in their trace mineral content depending on the soil that the plant was grown in and also the type of plant that's being considered. And then we have our vitamins that are required on a daily basis. The vitamin A, D, and E, these are our fat-soluble vitamins. Horses are able to synthesize their own vitamin K. And then when we look at vitamin C, humans don't have an ability to synthesize their own vitamin C, whereas horses do. That's why you don't see vitamin C show up on a daily requirement list for horses. There are some conditions where their demand for vitamin C will outpace their ability to synthesize it. And in those situations, like in times of extreme illness or a big microbiome upset, it may be appropriate to supplement vitamin C. But we'll talk about that more later. These are for horses that are, having light or heavy work. When we look at horses in late gestation, it's about a 15% increase over this basal requirement. And for lactation, we can get up to 2 times these requirements, depending on how heavy they're milking, just to give you an idea of what an average horse requires on a daily basis. But I think to really fully understand the impact of nutrition, we really need to consider the horse at a cellular level. We're in reality feeding trillions of cells and not just one horse, especially when we consider the horse's microbiome, so their GI microbial population, which has 10 cells for every cell of the horse. So we're really feeding all these different cells. But if we consider the common features of every cell, whether it's microbial or horse in origin, we can begin to see how every cell in the body is affected by what is consumed. So these common features are that all cells contain DNA that needs to be replicated, and then that DNA needs to be translated into the blueprints that are then used to make proteins. And then all cells use protein catalysts, also known as enzymes, to speed up cellular reactions. And then all cells require energy to function. A cell without energy is a dead cell. And then finally, all cells are enclosed in a cell membrane across which nutrients and waste must pass. In tissue, cells must also attach to and communicate with each other. And so what we observe as disease is really a disruption or inhibition or alteration of any one of these cellular processes. So when those are disrupted, the cell can't perform its function, and that cumulative effect leads to what we can observe as clinical signs of disease. So since every cell has a cell membrane, things that affect the health of the membrane have a critical impact on the health of the entire animal. When we focus on cell membranes, because they comprise a large surface area of the body, and they also are the membranes that line and enclose the organelles within the cell, they have such a role in communication and adherence to one another, and they have many membrane-associated enzymes, metabolic reactions that are occurring right near the cell membranes. And so what we feed directly impacts these membranes. So if you recall from biology classes, that cell membranes are a double layer of phospholipids. So it's fatty acid chains with a phosphate head on it. And so the lipids that are eaten in the diet are ultimately ending up in the cell membranes. Since this is a large portion of lipid within a cell membrane and fats being subject to oxidation, this means that processes that increase oxidative damage have a profound effect on membrane integrity. So if we had to pick one of those common functions that was listed on the previous slide, it's that cell membrane that plays a pivotal role in cellular health. So the types and ratios of fats that are consumed play a role in the inflammatory response of every cell. If there are more omega-6 fatty acids in the cell membrane, we get a more pronounced inflammatory response when triggered by the normal stimuli like invaders or allergens. And so we just really skew it in this favor. Overall, omega-3s have an anti-inflammatory effect. So this is just our different cell our cell membranes in here with our different enzymes, different glycoproteins on the outside. And so what we're doing with the cell membrane really has an impact, because both for the pro-inflammatory effects that omega-6s confer, and then also how they alter the fluidity of the cell membrane. If there's higher amounts of omega-6 fatty acids, we have a decreased membrane fluidity. A less fluid membrane has less of an ability to take up nutrients and to expel waste. So we really start to get this situation over here on the right where it's hard to get nutrients in and it's hard for the cell to get waste products out. So we start to see great impacts on the cellular metabolism in those situations. Whereas if we have a higher ratio of omega-3s, we maintain a more fluid cell membrane that is softer, more permeable, and so we're able to have that cell uptake nutrients more easily and pass waste out more freely. So I guess the take-home message for the cellular nutrition component is that we need to consider the health of the cell membranes when choosing what we feed our horses. Both wellness and disease are the sum of the functions of the cells of the body. So we really need to consider it from a cellular standpoint. If we look at our second polling question, I'm going to ask you, which of the following is your biggest concern with your horse? Is it colic? Is it arthritis? Is it poor hooves? Is it behavioral issues? You know, if it's not something on this list, you know, pick the one that is highest of the ones that are here. I'm not going to pick on chestnut mares, but if anybody answers D, I would say that it's likely that you have a chestnut mare. All right, so, you know, people who are concerned with arthritis, you know, poor hooves, couple with behavior, colic, you know, also had some affirmative answers here. So, you know, definitely kind of some top contenders here for things that we're concerned about with the health of our horses. You know, but what if I told you that there was a way to avoid these issues with diet? If you could make a small change to what you were doing daily to minimize these issues, would you take me up on that? So let's first consider the GI tract. You know, if the shipping and receiving department of an organization is dysfunctional, everyone's going to have a hard time getting their packages. Is anybody here waiting on something from Canada Post or Perlator recently? Similarly, dysfunction of the GI system impacts the availability of nutrients to the rest of the body. Also, the equine biome, the trillions of cells of bacteria, yeast, protozoa, fungi, they also play a pivotal role in total body health, not just limited to their digestive functions. Not only do the organisms break down fiber, but they also help modulate the immune system, and they also have a role in behavior. The compounds that these monocellular organisms are secreting do have a psychoactive effect. So the effects of the microbiome are system-wide and not just limited to the GI tract. There is work to show that horses that are more anxious have alterations to their microbiome. This is just a really fascinating area of research, and you can look for developments on this front to really be brought to the forefront over the coming years. But a lurking issue in both human and equine medicine is this concept of leaky gut. What happens is the connections between the cells that line the GI tract become altered. So chronic inflammation and oxidative damage being some of the leading contributors to these intercellular junctions, and substances that normally wouldn't make it out of the GI tract and into the bloodstream do. And they cause a variety of downstream effects. All of a sudden we have these different bacteria that are being taken up systemically, and they can induce an inflammatory or an infectious response in other organs. So if we can provide the gut with the nutrients it needs to function well and to optimize this microbiome, and then to minimize inflammation, we can have a better breakdown of feed, we can minimize colic, diarrhea, and then this dysbiosis situation where the microbiome is so completely altered and secreting different compounds into the system. You know, it has an effect on colic. When you look at those microbiome, those products that, again, that they're secreting, they affect GI motility. There's also gas buildup from these different species of bacteria. So if we can keep that microbiome happy, we're going to minimize those deleterious effects that they can exert. So really, if we can focus on one area to improve the health at a cellular level, it's the GI tract, because that has impactful effects on every other system and cell in the body. Another issue that is dealt with commonly are foot problems. You know, and horses have 4 of them, so even higher odds of something happening. And although hooves are a hard structure, it is a very dynamic, perpetually growing, protein-rich structure. When you think of the constant remodeling and turnover that is happening as the hoof tubules grow from the coronary band down to the sole, it becomes clear that this requires a lot of protein to make the keratin that are in these tubules. And particularly the sulfur-rich amino acids like cysteine and methionine are required for keratin synthesis. And if those are limited in the body, they're not going to produce as much keratin. And that's what provides the structural integrity of the hoof wall. Also, because we're constantly growing out hoof tubule, we have this is a close-up section of the lamina. There's the primary ones here, and then on each primary epidermal lamina, there's these little leaf-like projections, and those interdigitate with dermal laminae off the surface of the coffin bone. And this is what holds the coffin bone in the hoof. But as the tubules grow out, they need to slide along and reattach like little pieces of Velcro down these lamina. And that involves a lot of enzymatic work for those attachments to be broken down, for them to slide, and then to reattach. And if we're deficient in different trace minerals that are critical to the function of those enzymes, we're going to impair the rate at which the hoof can grow. So we have impacts on both hoof quality and hoof growth with nutrition. So let's consider the impact of nutrition in the development of a particular condition. Let's talk about quarter cracks. So this is when we get a crack out here on the corner at the coronary band of the foot. And while they're primarily an issue of foot balance, you know, the horse is overloading that particular piece of hoof wall, a horse with high quality, healthy tubules will be less likely to develop a crack than a horse with brittle, poor quality hoof wall. And so this can mean the difference between needing simply a balancing trim to correct the situation and a year of careful shoeing to repair. I like including this picture. This is a horse that came in quite lame. And as he was standing there, we picked up his other foot to put it on an x-ray block, and you can see this abscess rupture out here at the coronary band. And you can just see a little purulent trail down there. But this is a horse that suffered from some foot quality issues. This is another common condition where we have brittle and flaking hooves. This horse here had quite some angular limb deformities to its hind limb, and you can see the distortion in the hoof tubules here. You can see the rings, how they distort, and we don't have nice even growth patterns. And this reflects the abnormality of weight bearing that this horse had as a result of its hind limb issues. But it didn't blow out cracks because it had overall, those hoof tubules were decent quality. So it just shows if that horse had brittle hooves or hooves that were more of this nature, we'd probably be experiencing a lot more cracks in that foot. So proper nutrition can be the difference between the potential for problems and an actual problem. And the third important area where proper nutrition is impactful is in joint health. Many of you indicated that arthritis is one of your primary concerns with your horse. And it's estimated that over 50% of horses are retired due to osteoarthritis. Joint degeneration to a certain extent is a fact of aging, but really aging is only a minimal contributor in and of itself. Far and away, inflammation is the biggest contributor to decreased joint health. Additionally, oxidative damage from free radicals also plays a big role in the development of joint disease. If we can reduce the inflammatory load and protect with antioxidants, we can really help maintain a healthy joint. So this is a close-up. So this is a histological slide, so a stained slide of articular cartilage. So we have a bunch of chondrocytes in here, and they're secreting the matrix around them. And this is a close-up of the matrix here. We have these hyaluronic acid backbones with proteoglycans on here that really act as sponges to hold on to water, and that's what helps provide the shock absorbing capacity of cartilage. In disease states, those chondrocytes produce less extracellular matrix, and so we have less of these little brushes, less water being held onto, so less shock absorption. And you can see a progression through to a more diseased state. And when we lose that shock absorbing capacity and that gliding capacity, that's when we start to see arthritis develop. So we can actually help reverse and maintain this state with the nutrients that we supply within the diet. Those are the things like chondroitin, MSM, glucosamine, and hyaluronic acid. They all play a role in maintaining this normal, healthy cartilage. But again, when we think it's a lot easier to maintain something in a good state as opposed to trying to swim back upstream once we have disease develop. So supplying quality nutrients on a daily basis will help maintain this condition or help prevent it from getting so far downstream that we lose function of that joint. And interestingly, at least to me, the nutritional status of the mare has an impact on the joint health of her offspring. You know, this makes sense for things like copper status. If the dam is copper deficient, her foal will be copper deplete as well, and this will affect the development and cellular function of the joints. Foals born to copper supplemented mares had less developmental joint issues than those born to unsupplemented mares. That's, I think, pretty easy to get a hold of. But obesity plays a huge role as well. Foals born to obese mares were 3 times more likely to have OCD cartilage lesions than those born to mares in good body condition. You know, raise your hand if you've ever seen or owned an overweight broodmare. There really is no trade-off, or no free lunch. We can't have these mares in an overweight body condition and expect no effects on their own metabolism, but also the health of their offspring. And so joint-specific nutrients can help maintain joint health in an individual, and also careful attention to body condition and mineral status within our brood mares can help prevent a lot of commonly encountered developmental joint disease. I have a mare she's about 3 weeks pregnant right now, and I'm watching her body condition like a hawk. She's on some restricted grazing and practice what I preach, right? But these are just 3 areas where nutrition makes an impact. There are literally no parts of the body that aren't affected by nutrition. So how do we know if what we're doing is good, if our program is sufficient? And fortunately, there are some good indicators of health that we can use. If your horse is in moderate body condition with a shiny hair coat, good energy levels, and nice round formed fecal balls, chances are he's got a pretty good foundation. There's still the opportunity for some deficiencies of specific nutrients in horses that look the picture of health, but chances are the majority of that horse's needs are being met, and you can assess that visually. Body weight is another important factor to consider when we're looking at our nutritional status. especially as a trend. This is something we can monitor to see if a horse is gaining or losing weight. And this is largely a reflection of the horse's caloric intake. And then to go along with body weight, a little bit separate condition, but related, is the body condition score. And we may be tempted to think that if a horse is fat, that they must be having all of their nutritional needs met. You know, don't give in to that temptation. Overweight and obese horses are more likely to develop metabolic issues and have a higher level of inflammatory issues than a horse that's in moderate body condition. Overweight horses can also be lacking in specific trace minerals, as well as having lower fluidity in their cell membranes. You know, we really want to have a horse in moderate body condition. This is the ideal body condition. And there are many resources available out there for helping you determine both the weight and body condition of your score of your horse. We talked last week a little bit about determining weight. There's weight tapes. There's some different calculators you can use. And similarly for body condition score, there's several different charts out there. Platinum Performance has a handy one on their website where it takes you through how to score the different parts of your horse's body and do an average of those different sites. And I would encourage you to look into these resources and to develop a habit of doing this and doing it about monthly, just to keep track of where your horse is at. And so not all of a sudden like, oh my gosh, my horse is obese. As much as, you know, I would like to think that all of a sudden, you know, 20 pounds just appear and your jeans don't fit. It is a gradual process, and it's the same for our horses. They don't just get skinny overnight by and large, and also they don't become obese overnight. So with careful monitoring, you're able to track this more closely. And there are some things available for a more specific type of analysis to really drill down on what's happening both with your horse's diet and then within their body themselves. And I think that the best thing you can do when it comes to assessing your horse's needs is to determine what you're putting in front of them. So this is going to involve a hay analysis. As hay variety and quality can vary widely, and you can't see the protein by looking at a hay sample, you need to know what you're working with. And so you have to send off a sample and they'll provide you with a printout of the nutrient analysis within that hay. And so with hay analysis in hand, you can then have a very good discussion with the nutritionist or your veterinarian about what your horse needs. But without that hay analysis, you're handcuffing the nutritionist to only very general recommendations, which, you know, general recommendations, you know, broadly work, but to have a specific tailored plan, you need to know that foundational aspect of your diet. Then another approach to assessing the nutritional status of the horse is to do some lab work on the horse itself. You know, this isn't as straightforward to determine as CSI would have us believe. We can't just do, you know, a total body scan of the horse and know in moments what every level of nutrient is in the horse at one time. We can look at blood levels of albumin, which is a protein, creatine, and urea to get an overall sense of protein and muscle metabolism as well as liver function. But when it comes to total body levels of specific nutrients, blood samples don't often tell us the whole story. Oftentimes, the levels in the blood are tightly controlled, and it is only once the depot sites are either extremely depleted or over full that we start to see higher low levels in the blood. And so that blood sample really only provides a snapshot of what was going on at that particular moment and doesn't necessarily depict what's going on in the liver or in the skeletal system. But on the upside, these blood samples are easy to obtain and they are straightforward to process. We do get some meaningful information out of them, but we just, you know, can't determine total body calcium based on a blood sample. Something else that allows us to look more closely at total body levels are some tissue tests. Tissue biopsies of organs like the liver provide excellent information on the nutritional status of those depot sites. But as you can imagine, liver biopsies are a bit more invasive to obtain and also require a bit more complex analysis at the lab level. And then there's some other things that are you may have heard of in terms of analyzing the nutritional status of your horse. And kind of a fan favorite is hair analysis. So when you take a sample of your horse's hair and submit it. Now, hair analysis has really good value for determining chronic toxicity issues or, sometimes drug testing, but because we can see that build up over time along the length of the hair. But for a snapshot assessment of nutritional status, hair analysis really isn't accurate enough. There's too many factors like the color of the hair, sun bleaching or nutrient leaching, and then hair growth patterns where that horse is at in its hair cycle when those nutrient levels were fluctuating, that it really takes hair analysis out as an accurate measure of overall nutritional status. Again, excellent for looking for toxicity issues, not so good for determining current nutritional status. And if you've ever considered having applied kinesiology testing done, the hold this and see if you're stronger type of testing, you really save your money when it comes to horses. This, like hair analysis, is just so highly variable and also subjective that it really doesn't make for a useful tool for total body nutritional analysis for your horse. Something we may see in the future as more commonplace is analysis of the fecal microbiome and metabolome. There's huge projects being performed right now to establish what a normal microbiome looks like across various regions, diets, and in horse disciplines. And so, keep an eye out for that and the information that those microbiomes can provide for us. But my take-home message here when assessing nutritional status is to work with a qualified nutritionist to develop highly specific recommendations, to get a hay analysis done so you know what your foundation is, and then also to apply some general guidelines in assessing your horse's physical appearance and their health status. Horses are what they eat, just like people. And with that said, do you think that we are feeding horses the way nature intended? With every meal and with every bite, we have the opportunity to affect cellular biology. So if we look at how we're currently feeding horses compared to how they were designed to be fed, when we look at horses that get to have this natural diet that are grazing several hours a day and they have lots of turnout, you see them, they're kind of browsers, and they'll have a variety within their diet, and it's based on fresh grasses as well as some other plant species. And when we have horses get to eat in this manner, we have decreased inflammation. We see less occurrence of ulcers. We see less pronounced allergic responses, less free radical damage. Their recovery time is shorter, and they have less soreness and fatigue with exercise. And if we think of our typical modern diet, most horses aren't free to browse and roam, and they have significantly less turnout than their free roaming counterparts. They're often stalled with limited access to pasture grazing, and then they're fed meals of hay and grains or concentrates, which just, when we talked about their digestive anatomy earlier, being small stomached and being continuous acid secretors, meal feeding really doesn't lend itself well to horse health. We see increased inflammation with this type of diet, and again, kind of the exact opposite of what we saw in the natural diet. We see more ulcers, we see more allergies, more oxidative damage, slow recovery time, and more soreness and fatigue with exercise with this type of diet. And interestingly, it mimics the things that we see in humans who are on a highly processed diet. So the things that are somewhat epidemic in the human population, we're also seeing those same trends within our horses. So when we look at that fatty acid ratio, that ratio of omega-3 to omega-6s that's important for cell membrane health, the natural grazing diet would have a 5-to-1 omega-3 to omega-6 ratio. When we see our typical modern diet with grains and concentrates as a component of the diet, we see an inverted ratio of about 1 omega-3 to 30 omega-6s. So this omega-6 to omega-3 ratio really contributes to higher rates of chronic disease in both horses and people. So if we think of disease as that collection of cellular disruptions, chronic disease really is an inflammatory response, and it just depends on what cells that we're dealing with. In the joints, it becomes arthritis. With the immune system, chronic inflammation can help stimulate allergies, and then we have diminished recovery, laminitis, when we don't have that appropriate enzyme function within the feet or those cellular connections, we are more prone to laminitis and just more rapid cellular aging when we have this chronic inflammatory response. But what can we do? Fortunately, we can keep things pretty simple in our interventions for combating this situation. But basically, our action steps, you need to know what your requirements are for your horse. You need to know what their body weight and body condition is, what their health requirements are, and what their activity level is, if they're pregnant or if they're lactating, and just really working to understand what your daily requirements are for your horse. Once you have determined that, horses need an ample source of fresh water, and they need a source of salt, like they do have that salt drive. And we need to feed a high quality forage. Pasture if possible, that fresh is best scenario, if there isn't a medical reason to avoid fresh pasture grasses. But what about the 8 months a year when there is little to no grazing available and we have to feed stored feeds like hay? Are forage and hay enough? Even the nicest hay, like the stuff my husband and I have been dodging rainstorms and marital disputes the past couple of weeks to get put up, it loses nutrient value rapidly. When we look at the omega-3 fatty acid levels, within 10 weeks of harvest, they've dropped by 83%. So that's a substantial reduction from fresh to stored feeds. And a similar trend is seen with vitamin E. This decreases dramatically post-harvest as well. We have this 86% loss within 6 weeks. So a short answer, no, hay isn't enough to meet the nutrient requirements when feeding for health and performance. Energy and protein may be sufficient in the stored feeds, but the fatty acid, trace mineral, and vitamin requirements won't be met by a forage-only diet. So knowing that, to our action steps, we need to add in a supplement. Now this is where we can run into an overwhelming array of choices, but there are a few things I want you to keep in mind when considering them all. Overall, supplements have different regulations than pharmaceuticals do. Supplements only have to be proven safe rather than proven efficacious. If you're reading a label and it says that it grows long, luxurious hair or high quality hooves, they actually haven't proved that statement. They can put whatever they want for claims on there. All that is regulated and required by law is that they prove that what's in there does no harm. So a little bit different situation from drugs that have to prove their efficacy. But be aware that purity, potency, and bioavailability really varies greatly by the product. So some things to look for within the different categories of the nutrients we're looking at. For vitamins, across the board, they degrade quickly, right? So look for the freshest dated product. If you have something that has sat on the shelf for 3 years, or it boasts a shelf life of, 3 to 5 years or even a year, you can be sure that by the time you get to feeding that last scoop of that container, that the vitamin content that was initially in that product is greatly reduced. I wouldn't be surprised if there was less than 10% of their original amounts that's available. So look for your freshest dated product. When it comes to trace minerals, bioavailability is important, and the chelated and organic minerals are more bioavailable than inorganic. This means that your horse is going to pull them out of the diet more effectively and have them available within their body. The flip side to that is that the chelated tend to be a bit more expensive. So when you're comparing prices, that is a key difference between mineral supplements, is that chelated or organic source versus an inorganic source. When we're looking at probiotics in ways that we're helping that microbiome, we need to consider what organisms are present and in what numbers. And so when you're reading the label, you need these colony forming units, so these CFUs, in the billions per day. That's times 10 to the 9. So when you're reading the label of whatever product, look for something in the billions. And the probiotics, those are living microorganisms that exert an effect on the GI tract. And so for them to do their job, they need to have survived the manufacturing process. And so if you have a probiotic supplement that's in a pelletized or extruded form, the likelihood of that probiotic surviving that process is pretty low, because those processes generate significant heat. So just keep that in mind, that your loose formulations, the powdered formulations, are going to be more likely to have living organisms in them. When we're looking at the omega fatty acid supplements, these two they degrade and are oxidized easily because of their fat content. And so you want to have a good antioxidant stabilizer in them. An alternative for omegas that's often offered is ground flaxseed. And that's a good alternative or a good supplement, but that needs to be ground fresh. If you're buying something, that's a supply and it's ground, it has a lot of surface area exposed to air, so it's going to be largely broken down by the time you go to feed it, unless there's significant antioxidants added, or if you're grinding fresh every day. That's a great route to add flax into your horse's diet as an omega supplement, but needs to be ground fresh every day. Otherwise, you're not getting that omega content. Also needs to have, again, fresh dating and low heat processing. Things that break down fats are high heat. And then the type and ratio of omegas are important. We really want to aim for that 5-to-1 omega-3 to omega-6 ratio. There's different omegas out there, whether it be camelina oil or hemp oil, and those ones are going to have different ratios of omega-3 to omega-6. So if we can just get closer to that 5-to-1, those are going to be better interventions for our horses. And then another thing you need to consider with your supplements is, have the contents been tested for compatibility? Do they know that once they mix all the ingredients together, that one isn't harming the other? Or if you have multiple different supplements, are you overlapping? Are you having an additive effect? Is there selenium in one and selenium in another? Something for compatibility to be aware of is our trace mineral content and its relation to probiotics. If we have a product that has higher levels of copper in it, remember, we sprinkle copper sulfate on algae to to help control it, or we use, copper sulfate as part of, thrush treatments. And so too much copper can have a deleterious effect on probiotics. So whatever one you choose, do a little research to see if what's in the bucket is actually making it into your horse in a meaningful fashion. So if we look at our third polling question, how did you choose your last supplement for your horse? Was it based on the recommendation of another horse owner? It had the best price at the feed store. It was based on a known or approximated feed analysis and consultation with a nutritionist, and I feed horses the same way my dad did. Or whatever most closely describes it. Right, yeah, so the other people with horses, they have a strong influence on our choices, right? And you see that, kind of that case stuff. If you see how a person's horses look and you're like, oh, what are you doing? And you get these recommendations. Nobody's buying it based on price here, which is good. Kind of another soapbox moment. You get what you pay for. There's people who've done some more in-depth analysis, and then who this 11% is. I've been guilty of that for several years, and it wasn't until I really got to understand the impacts on a cellular level that's really changed my perspective on supplementing my horse. So I'd like to talk to you briefly about a pretty exciting nutritional solution that ticks all the boxes. Now, this is not the only one out there, but it's the one that I know best, and it's the one that I have my horses on as what I've recommended for patients within my practice. And that's Platinum Performance. And it's true, like, we've spent the last 45 minutes discussing that good nutrition is good medicine. And this is a product line that's available in Canada through veterinarians or online. And Platinum Performance has a very rich legacy. Its founder and developer, Dr. Doug Herthel, was a pioneer in equine medicine and surgery. And the company was developed to share what Dr. Herthel learned and used in his hospital, and wanting to share that with other practitioners to help them have more successful outcomes in treating cases. We've talked about why you need to address nutritional issues and the impact that they can have. And, if you think that wellness is expensive, the cost of sickness will alarm you. So anything that we can do to stack the deck in our horses' favor and feed them for health and performance and longevity is an excellent investment in our horses. And all of the products within the Platinum portfolio were developed out of clinical necessity for horses to heal more fully, to recover faster, and to prevent conditions from even occurring. There needs to be nutritional support. And unlike many other supplements out there, which, remember, only have to show safety, Platinum is backed by decades of research proving its efficacy in many different clinical situations. And this is one of the things that sets Platinum apart. And for me as a practitioner, I really like to see that they actually have shown their label claims, that what they're putting out there has been backed up by scientific research. So every horse can benefit from this nutrition. I like this quote from Dr. Mark Ravanaugh. If the nourishment and overall wellness isn't where it needs to be, it doesn't matter what you put into the horse's joint. And this philosophy applies to any horse owner, because we all know there's a price tag that comes along with these amazing animals, regardless of whether they're just a pasture pet or an elite level dressage horse. And so, oftentimes we think, like, how can I afford to add a nutritional solution to my program? Really, it comes down to you can't afford not to when you look at the far-ranging effects that it has. You know, we've talked a lot about this ratio of the omega-3 to the omega-6s, and Platinum Performance is really striving to create that pasture in a bucket. It comes as close as we can to that 5-to-1 ratio of omega-3s to omega-6s that fresh grass has. You know, and seeing the ratios of other common feedstuffs, it really drives home the value of knowing and understanding what you're feeding and your goals for your feeding program. You know, when we see here for corn that we have a 54.5-to-1 ratio, how many of us have used corn oil to try and put weight on a horse, right? Like, we may get a shiny coat out of there, but when we consider the health of the cell membranes at the cellular level, we're really, really backsliding with those types of ingredients. You know, so what products does Platinum have available? And they really keep it simple with this one bucket approach. Raise your hand if you've got the feed room with 6 to 12 different containers in it, and mealtime for your horses, you know, a scoop of this, a scoop of that, half a scoop of this, and a dash of that. You know, you start to wonder, is this cost effective? Is what you're giving complementary, or are you over supplementing certain components? Can one thing in one negate another? And Platinum Performance products are all designed to work together and not overlap. So you start with the foundational formula. So you have this wellness formula, and it's great for any horse. It's a whole horse approach to foundational wellness, and it targets those trillions of cells for that whole systemic impact. And really, it's felt that the cumulative effect is just greater than each individual one of its parts. And so it's got the omega-3 fatty acids in it, largely in the form of cold-pressed flax oil. We have a great array of amino acids and the required environments, good doses of antioxidants, both for stabilizing the fatty acids and also for uptake into the body, and also a good profile of trace minerals. And, you know, with this profile, it's recommended basically for any horse, from foals through to senior horses. Every horse can benefit from the addition of the omega fats and trace minerals and vitamins into their diet. And then if you're facing a certain condition, add in a targeted support where you need it. So you have the foundational plus the digestive care, which is probiotics and glutamine, or the joint health, which has hyaluronic acid and chondroitin and acetylmalurostoliate. So you really want to, you know, get things right in terms of your inflammatory load, and then add in the specific nutrients as needed when your horse is facing different conditions. A common combination that we also see done is the foundational formula and both the digestive care and joint health. And the nice thing in keeping things all in one line is you know that these are all complementary. You don't have to worry about additive effects between the different components, and there's not that overlap. So really, you have a streamlined way of adding things into your horse's diet. Just a few things on what sets Platinum apart. You know, again, we have, you know, they have that extensive research. It's high quality ingredients. It's made in their own facility in California. And because they have such a broad clientele, with many of them being Olympic level athletes that are undergoing frequent drug testing, any impurities or contamination of the product is not tolerated. So they're tested and then really tested again. You know, every ingredient that comes into the factory is tested for purity before it's even put in a product. And then they're even tested by third-party labs to make sure that what they're putting out there is exactly what is on the label. They also have a 100% satisfaction guarantee. And if your horse does not like it or does not have the results that you anticipate, they're going to do all they can to make it right. And like I mentioned, they have that peace of mind for competition in terms of their testing. And this is not a uniform characteristic across supplements. This is something that Platinum goes above and beyond to do. And so if you're interested in trying these products, talk with your veterinarian. they can point you in the direction of where you need to go if you have specific conditions that you need to focus on within your horse. And also give the team at Platinum a call and talk to a Platinum advisor. You can reach them online or by this 1-800 number. They're a fantastic team. All of them are experienced horse owners themselves, as well as having degrees in nutrition or science degrees or business degrees. They're just very well versed to help you come up with a plan for your horse. I've had nothing but positive experiences with them. So if you're interested, I would really encourage you to give them a call. All right, I think we're near the top of our hour here. So if there's any questions, please feel free to ask them, or you can email me, or the platinumperformance.com website really does have some great resources on it if you're interested in more information on this anti-inflammatory nutrition. But really encourage you to keep a close eye on your horse's nutrition, and just to consider the impact that it has, but also keep it simple. It doesn't need to be a big and scary thing. Just keep in mind the basic requirements that it needs, and tailor things to suit your horse and what works for you and your budget.
Okay, anyone have any questions for Dr. Quaschnick before we all go? Don't be shy. Alrighty, well, if there's no questions, once again, thank you to Zoetis. Oh, there's a question. Oh, no, it's just a thank you.
Oh, well, you're welcome.
Yeah, so thanks, Dr. Quaschnick. Thanks to Zoetis for supporting our Traveling Roadshow and our Not So Traveling Roadshow programs. If you do think of something, you know, later on that you'd like to ask, you can email Dr. Quaschnick. Her email is at the bottom of the screen. Or, oh, here, we do have a question for you. It's from Arlene, and she's asking, how do you feed Platinum supplements, mixed or straight?
So Platinum, yeah, good question, Arlene. My horses, it's just like, it kind of has a texture of like graham wafer crumbs. And so I just feed it in a pan. You can feed it loose. You can feed it as a top dress as well if you're feeding some sort of concentrate. But really the beauty of the Platinum is that you can really, you know, get away from having to feed a pelleted or concentrated feed. So you do have some flexibility of options there.
Okay. So I guess that's a wrap. And again, if, you know, feel free to email Dr. Quaschnick. You can email us at Horse Council development@hcbc.ca as well if you have any questions. All three of our sessions are on the HCBC website and YouTube channels. So, you know, feel free to jump on there and have a look if you've missed them or want a refresher. And that's it. Thanks, everybody. Have a great afternoon. Bye.